Hi, guys, and welcome back to RT Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the asthma lady. Okay, so this week we're going to talk about how to prepare for the asthma educator certification exam. Okay, for those that are interested. So basically, but you know what? Before we talk about that, please hit the like button and share and subscribe to us on YouTube. And we are also on Google Podcasts. So please subscribe. Know that we are growing together. All right, guys. So thank you so much for that. Okay, so based on the episodes we had prior, the 6 skills you need to be a asthma educator, and 6 reasons why to be an asthma educator. To be honest, I should have made this a series, but I guess I'm just thinking out loud. But yes, so now we're gonna piggyback off those episodes. So based on what you saw the last couple of weeks, now you're like, you know what? I was meant to do this. Okay. I want to be a certified asthma educator. So that's what we're going to talk about today. You're going to want to, well, you're going to have to become certified. You got to take the exam, right? So today we're talking about how to prepare to take the asthma certification exam. Okay. So first, you need to know that who is qualified to take the exam. So know that if you are licensed or credentialed healthcare professional, you can take the exam. So if you're an RN, LPN, RT, a nurse practitioner, doesn't matter. You can take the exam. You qualify. Now, if you are not any of those, you need at least a minimum of 1,000 uh, direct patient asthma education hours. Okay, so that is for those who are public health educators, community health workers. So if you have been doing this type of work already, you just need to have it documented that you already provided 1,000 hours of that type of education. Now you would get someone to witness that. So basically, like someone like me, a program director who will write off for you and say, yes, I witnessed that this person did that. So then you send that in and you can sit for the exam. You qualify. So, fun fact, I mean, it's fun to me. Um, there are currently 3,260 certified asthma educators. Right? So, and know that according to the Asthma and Allergy Foundation of America, there is currently 25 million people with asthma. All right? So you do the math. So that's a whole lot of people with asthma and not that many certified asthma educators. So what does that mean? That means go get those letters behind your name. Okay? Get the AEC, Asthma Education Certification exam behind your name. Get those credentials. Is worth it. And you will be considered a unicorn because not that many people have it. All right? And unfortunately, asthma is not going anywhere. It's just not. Okay, so the exam costs $350 right now. So that's for the first time. So it happens. If you have to take it again, after that, if you take the first attempt, you didn't make it, you could take it again for $250. And then to recertify, you have to recertify every 5 years now. It's $300 to certify, to recertify. You send in your CEUs or you take the exam again. Get the CEUs. So yes, and I believe the CEUs is 35. You need 35 CEUs to recertify. Okay, so and yes, you can on N the NAECB website, they do have scholarships to take the exam. So if you qualify, go on their website and you can see if you qualify for the scholarship. So for the exam, which is to okay, let me backtrack. For you to take the exam, you go to the National Asthma Educator Certification Board website, the NAECB. And so the first step to take the exam is you need the candidate handbook. So that handbook is very important because it's going to give you an idea of what the exam looks like. Right? And so based on the handbook, it will show you the matrix of the exam. So basically, it'll let you know how many recall questions they possibly will be, application, analysis. So start and it'll give you each category of what is going to be asked on the exam. And there also the candidate handbook also has sample questions just to give you an idea of what some of the questions will look like. So I highly recommend that you look at this handbook. Uh, uh, just give it some time to thoroughly look through it because it will help you greatly. Know what your number two. Know your learning style. So what do I mean by that? Okay, so for this exam, there are a lot of resources out there. So there are YouTube, you have doctors and other RTs and nurses that have material on YouTube already. There are books, there are courses, but you have to know how you take in information because you don't want to just be spending money um willy-nilly because somebody else told you, hey, listen, this worked for me. I mean, and especially if you have not been in school for a while, if you're just like, okay, you know what, I want to take this exam. You can't just take, it's good to ask people, but you know what works for you. So I highly recommend that you think about that. Like, okay, if you're a visual person, then start to go towards those resources first. Okay. Number three, I highly recommend you take a prep course for this exam. Why do I say that? Okay, doctors have taken this exam and failed. Respiratory have taken an exam and failed. Nurses, and whatnot. Why? I will tell you, when I first took the exam in 2010, I did not study for the exam. I thought I was a respiratory therapist. Asthma's our bread and butter. Why do I need to study for this exam? I passed my cleansims and all my certifications and everything quick. I mean, immediately, right? So now I'm like, okay, I'm gonna take this exam. I took it without the prep and I failed the first time. I failed. Okay. So you have to know how to take the exam. I highly recommend a prep course. So, because you need to know your things like you need to know your stepwise approach for your treatment for stepping up or stepping down for treatment. You have to know how to classify the patient, whether they're intermittent, persistent, if they're in the persistent category, or they mild, moderate, or severe. So these are really important. You need to know things about funding and creating a program or creating content for asthma patients depending on their culture. You understand? And if you're not about that life, well, like how do you understand? Like how would you know that type of stuff? So a prep course is very, very, very important. And you have a few organizations, American Lung Association, you have the AAFA, QHC seminars has a prep course in November, and somebody you know and trust speaks for them. Me. All right, shameless plug. So yes, they have a prep course every November, each year in November to take for the prep course for the asthma certification exam. All right, now you can pay for exam practice questions. The NAECB, I believe their questions is $75. This is hit or miss because just because you pass their certification, just because you pass their questions, does not mean you're going to pass the exam. So hence why I'm saying to take a prep course. So you might pay the $75 and think you're doing really well on the questions and then not pass the exam. So you have to understand how to take that exam. It's not it's just the way it's styled. It's a long exam. The questions are, to me, now disclosure, I have not taken this exam for a long time, but from what I remember, the questions were really long. There was a lot of fluff in the question. Um, you know, a 8-year-old boy, Johnny, has a dog, but he stays with grandma, and grandma has a bird in the house. But then, the daycare center does the questions are really, really long. So you need stamina for that exam. So yeah, know that it's 175 questions. 150 of them get scored, and it is a 3-hour exam. All right. So, yeah. Yeah, you need the stamina for that exam. So, for the day of the exam, please get some good sleep. I know that's easy to say, but and harder to do, especially if you work night shift like I used to. But get some good sleep the day of. Eat breakfast and pray. All right. And yeah, when you take the exam, go use the bathroom. All right. So I had a lot of water that day. I experienced that. I had to leave the exam to go use the bathroom, and I started to run out of time. I had 40 questions left and 20 minutes, and you need about a minute a question. So what did you think I started to do? B, 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 B. I started just randomly picking, right? So yeah, and no blank answers, because if it's blank, it's wrong. So just pick something, right? And watch your time. The time is going. Like I said, the questions are extremely long, and you have to know how to navigate through the fluff. Okay, so because there's a lot of fluff in those questions, so you have to hurry up and be able to extract what you need from the question and be able to pick the right answer. Because when you look at the answers, most of them are correct. Most of the answers are going to be correct. It's just not for the specific question. So you have to hurry up and identify what the question is specifically asking for that patient or that time or that scenario. All right? So that's really, really, really important. So that's why it's like take the pep course, practice questions, and like we said, know your learning style. Because if flashcards will work for you, go with that. But if you're just more like, I just need to read the book real quick and then take questions, then go with that. But that to me are the really important things to taking that exam. And like I said, once you get it, you are a unicorn. All right. And like I gave you the stats before, it is more certified asthma educators. We need more of them in the world. Right. So yes. So anyway, I hope this helped somebody out today. And I just want to say that, we just need to take control of these careers and start making decisions. and not chasing checks, right? So just know that just like asthma, it's all about gaining control and progress, and just one step at a time. All right, folks. So know that we are here every Wednesday, 6 p.m. Eastern Time. Once again, remember to subscribe to us on YouTube, like, and we're also on Google Podcasts. All right, guys. And so remember to invest in yourself and to compete with only yesterday's version of you. Thank you, guys. See you next Wednesday. Bye.